Welcome to Life and Godliness with Dr. Joe. This is where we talk about all things life and all things godliness, and we seek to figure out life with Jesus and community. We are really here to just learn and grow together, heal together. God really has a desire to walk with us through the difficulties of life. And today we have Geraldine Garwood. Hello, Miss Garwood.
Hi, thank you for the invite.
It is so nice to have you here. I mean, this topic is a really tough topic. And I really wanted somebody who would do it justice and would really be able to walk us through. I don't think you know, but I had met you some years ago while I was working at another at a nonprofit organization.
Research.
And uh,
It's real
and
work.
well, it was some years ago, some years ago. And so when I asked a friend, a colleague, and she gave me your contact, I was like, oh, I know her. So I'm so grateful that you are here, that you are on here with us, just to share about grief and loss, and just to talk about, this just some of the difficulties that we go through. Over the years, personally, I have had very close family members that have passed away, very close friends, tragically, really difficult ways. And so this is very close to my heart. And of course, there are other persons I know who have also experienced close loss. And so sometimes we don't really know, how to. Oh, sorry. Let me just admit some of the persons who are coming in. Sometimes, we don't really know how to process,
Yeah,
what we're going through. So I'm just gonna introduce you and then we're gonna start.
no problem,
We're
no
just gonna
problem.
jump right in, okay? So, doctor, I was gonna call you doctor, but
Soon to be. Soon to be, soon to be, soon to be.
So, Miss Geraldine Garwood, she's a clinical psychologist, behavioral specialist. She is the author of a book on grief called An Affair with Grief. She is as the CEO of Behavior Change Consulting Services, and she offers grief therapy, behavior therapy, complete assessment for children with autism, ADHD, and other developmental delays. I mean, these are so important because there's so many persons who are looking for places to go to conduct these assessments, and
Yes,
it can be so hard to find places. And so I'm really glad that I'm able to, share this with the world as well,
of course.
All
I'm glad too.
right. So firstly, I wanted to share a little bit about grief. So I know you wrote a book on grief. Could you tell me, what led you to write that book?
All right. Um, I started to pen my book from 2020, 2020. Oh, before that, I think it's the
Mm-hmm.
pandemic.
Mm-hmm.
Persons having cumulative loss. I really started the book during that time.
Mm-hmm.
And then I paused the book, but then I lost my nephew
Mm-hmm.
in 2024. Right,
Mm-hmm.
a year now. And that plunged me into a deeper grief because it's as if I lost a child
Yeah.
because I grew him. So for me, he was a baby. He is the first grandchild for my mother
Mm-hmm.
and us and siblings on my mother's side. Because I had two siblings um, by my father's side. They were older. So for my
Mm-hmm.
mother and father, he was the first grandchild. So we were excited when he was born. And he was
Mm-hmm.
born when I was young too, you know. So
Mm-hmm.
I we spent a lot of time in my home. We helped to rear him. He was always with us and he became like my own. So
Mm-hmm.
very mannerly and all of that. And
Yeah.
so he died suddenly. He just took
Mm-hmm.
ill at work and said he didn't feel well and he was thirsty and then he just fell and that was it. And
Mhm.
so that grief did something to me. I
Yeah.
felt a pain from my womb and I said, no, I can't imagine what his mother is feeling if I'm feeling like this. But I was really, really distraught. And I've had other grief that took a lot out of me. But
Yeah.
this one pushed me and said, I must complete the book. And
Yeah.
so I completed the book um, and shared, it started out with his story. And then I went in detail to talk about grief, what it is like, types of grief, and all of that. And of course, there's a part two coming to that book soon, right?
Okay. And
Right.
what could you share us with us a little bit about what that part two?
That part two would look at it would be like grief unspoken. But there's
Ah.
some grief that people don't talk about. So, like mastectomy, losing part of your body image,
Mm.
and
Mm-hmm.
those things that are not dealt with. Having a diagnosis, you know, that type of grief, or you deal with that. I mean, grief in relation to abortion,
Mm-hmm.
because persons don't believe that people who actually commit abortion go through grief as
Yeah.
well. Grief in relation to being a victim of somebody who has a suicidal death and what that is like, because
Mm-hmm.
how the public view. So those kind of grief unspoken, a number of grief that people don't talk about, because
Yeah.
some of them mean be deemed um society don't want to allow you to grieve in that context. So
Right.
grieving a homosexual partner who die, you don't really hear much of that because
Mm-hmm.
society and what those persons actually go through. And so the Holy Spirit led me to complete a part two where that book will look at that grief unspoken, what we don't talk about that we grieve about. So that's
Okay.
part two coming out as well.
Okay, very interesting. And meeting people where they're at,
Yes,
and just recognizing that these are human experiences and being able to take persons through those human experiences help to show the love of God as
yes,
well.
yes.
So could you tell us a little bit about what grief actually is? Could you describe it? And I know, I entitled this podcast Grief and Loss. So if you could tell us what grief actually is and then how it relates to loss.
Well, loss is everybody experiences loss.
Mm-hmm.
Loss and grief are both a natural part of life.
Mm-hmm.
So we all experience loss. Loss of a job, loss of your home, loss of a pet, loss of a nice dress that you may have. And grief and loss can be interrelated. So grief is the natural
Huh?
response to a loss.
Mm-hmm.
So really and truly, you grieve when you have a loss. So grieving is a natural response to the loss. So the response that comes based on the loss and how you are attached to the thing that you lost determine what you grieve. So it's really
Mm-hmm.
simple. It's a natural response to loss. How do we respond, whether psychologically, spiritually, emotionally? That's really what grief encompasses, you know?
Okay.
So
So, so is grief like, so is it a natural process? Does it happen right after the loss happens? Does it take a while before you are, kind of catapulted into grief? How does it work?
it depends on the individual and it depends on the nature of the loss and the type of loss. Then grief for each person is different. So grieving is personal. Just like what I
Mm-hmm.
tell persons that salvation is personal, grieving
Mm-hmm.
is personal. It's a personal journey. So no
Mm-hmm.
two persons grieve the same way, and we should not compare people in their grief. We should just
Mm-hmm.
allow persons to grieve. So I mustn't compare you with anybody else, and you should not compare me with anyone else because each person grieving style is different and your grieving style depends on your personality, your history of reinforcement, meaning that your socialization and your actually your own involvement in grieving process or observing persons grieving, that determines more often than not individuals grieving style. So that's why we don't compare persons grieving style. Some persons may laugh through grief, some person may cry, some persons may have different features. And it is a common thought that crying is the only way to show that you're grieving, and that is really not so. So grieving is personal, and everyone have their own style of grieving, and we should understand that, know that, and be sensitive to that, and allow persons to grieve.
So you mentioned laughing. Like, why would persons laugh during the grieving process?
Because more often than not, the person who generally laugh tends to be going through shock same way and denial. And so they will
Ah,
be laughing, laughing because it's like it has not really kicked in yet for them. And
mm.
it may take some time. Again, I don't want to jump the gun because I think I'm going to
No,
be
go on,
speaking.
go on, go
I
on.
think I'm going to be
Flow.
I think I'm going to be speaking on some types of grief, but some persons may, and this is one type of weakness I will talk about a little earlier in the game. It generally happens because some person may not grieve at the same time because they may delay their grieving process. We call that
Mm,
delayed grief. So delayed
mm,
grief will come like, I have my exams tomorrow or next week, and I lost my dad, and
mm-hmm,
my exam is critical. This law degree is also important, and I have law exams next week, psychology exam this week, CXC next week. And
mm,
so, depending on my personality, I can put off my grieving. I can delay my grieving because I must prepare for this exam. I must go into this exam. And so I delay the grief process. And then after that, I can just be plunged into grief. But sometimes for those persons, um, something will have to trigger them, and then they just go right into the grieving process. So another death can also trigger them to go in the grieving process. Something they see and they will go in the grieving process. But some trigger normally takes place and they go into the grieving process. So I kind of use myself as an example. When I
mm-hmm.
lost my father, because of the role I play in the church, I actually assisted in terms of his funeral. So
Right.
I don't think I grieve at the time because I was ensuring that things were put in place, the service was going as it ought to, and all of that. So I was dealing with a whole lot. So during that time, I didn't get the chance to grieve. But
Right.
afterwards, after everything, he was laid to rest, like, probably a year after I realized that I did not grieve for my father,
Mm,
and therefore that's the time I began to, having gone to other funerals and sitting down and then hearing a person with their father, I realized that I did not grieve for him. And that's the time I started to grieve for my dad. It took
mm.
me a year or so after because I was so integral in ensuring that everything went well for his funeral and all of that.
So sometimes we can be so busy that we don't even get a chance to process the grief. Is that?
Right, right.
Yeah. And then also, I mean, so I know even as mothers, as parents, as fathers, sometimes when a loss happens, because we have to kind of continue parenting, it can be hard to process. But can you tell us a little bit some of the other types of grief? I mean, since we've started with delayed grief, what other types of grief are
All
there?
right. So we have what we call disenfranchised grief. That's the grief I talk about when I talk about grief unspoken. That's
Mm,
where society do not give you a right to grieve, permission to grieve. Right.
okay.
So you're not allowed to grieve if you have an abortion. You're not
Mm,
allowed to grieve if you society don't give you the right to grieve for that because you're condemned for doing such an act. So why are you grieving? You're
mm,
not supposed to grieve if you lose a partner who is homosexual. If you're in a lesbian relationship or homosexual relationship, if you lose your partner, society don't give you the right to grieve for that either. Doctors and patients, society don't really give you the right to grieve, or patient as a medical doctor, some of those professionals, because this person is nothing to you. It's your
mm,
job, and you go through this every day. So why would you, as a doctor, be grieving over this man that you don't know, or this woman, this patient that you don't know? So that's
mhm,
what we call disenfranchised grief. It used to also be in the profession of teaching. Why would a teacher be grieving for a student when you have so many students? But we see that kind of change. But even so, you still don't see the teachers openly showing their grief because
Mm.
society really did not give them the right to grieve. So we call that disenfranchised grief. Then go ahead. You have a question for that?
Yeah, before you go ahead, because that, I mean, that's a lot. That's a lot right there, right? So first, in terms of what some of the more taboo issues, I think it, in terms of how as Christians as well, do we work through being able to empathize with a loss, even though we don't necessarily agree with what was done or the relationship
Well,
or
we have to empathize still. We may not agree with the relationship. I left out one important one too, the death of a pet. Society don't give you the right to grieve for your pet. You lose a dog. People you're crying over a dog. I remember when I took I think this was my first dog that I euthanized because he was ailing from cancer. And a young
Mm,
man in my community accompanied me because I had to lift the dog in the car and all of that. And he was waiting. And when the procedure was done, I wept. And he's like,
mm,
you really cry for that? Miss G, for one dog? Him couldn't get it, couldn't
mm-hmm,
understand it.
mm-hmm.
Society don't give us the right to grieve for our
Yeah,
pets. We have more important thing to do. Why are you grieving over a dog? Why you take time off from work to grieve over your dog? It's a dog, and you can always replace it. That's
yeah.
what people think. So as people of God, we should be empathetic. It doesn't matter what, because grieving is a process and it causes pain and it causes people to go through
Mm,
emotional turmoil. And so, as a Christian, we should be there to empathize with those persons. We may not agree with a homosexual relationship, but the person is still grieving the loss of somebody whom
mm,
they choose to love,
mm-hmm,
right? And even as Christian, we have to love those persons too, whether we acknowledge or we endorse their relationship.
mm-hmm,
So, I mean, they're still going to grieve because they love the person, they had a relationship with the person. So, just like how we can empathize with somebody who's in a heterosexual relationship, we
mm-hmm.
have to empathize with the persons who are going through a homosexual relationship because they're experiencing the same grief.
Yeah,
Whether
yeah,
we agree with their lifestyle or not, they're still grieving, and
mm,
grieving is grief.
yeah, yeah, yeah. Okay, okay. I mean, I had to ask, so you can
Yeah,
continue.
and
You can
that's
continue.
yes, and that's fine. So it leads me to the other one when I talk about pet abbreviated grief. That is a
Mm,
short form of grief where we substitute. So some people go through that. And even with the like of a pet, some people made us get another dog to substitute.
mm,
Abbreviated grief is also attached to relationship. And it mostly happens for males too, where if they lost their spouse within 6 months to a year, they remarry.
man.
Yes. And while a female will wait long enough and have on
Mm,
a wedding band for all 5 years. And you say,
yeah.
why are you wearing a band? You're a widow. You really shouldn't be
Mm-hmm,
wearing a band. You're a widow. Why you having a band?
mm-hmm,
You're not married. You're a widow. Um, a man is not going to wait so long. And they can abbreviate the grief, meaning that they substitute for that spouse that they have lost. More often than not, sometimes some of those relationships have challenges because they begin to compare, the persons, because my former wife would have done this way because they didn't
ah,
take time to get to actually know the person, but because they may have children that they want somebody to come in as a role model to help care for, they may have, and somebody come that they may have some attraction for, they just quickly remarry. So
okay.
abbreviation grief is substituting, right, to fill that gap for what
So
you
it's like
have
a,
lost.
so it's like a coping mechanism.
Right. It is generally used as a coping mechanism,
Okay.
right? And that happens a lot, and that can put relationships into crisis.
Yes, because it's interesting. I was talking to one of my friends some time ago, and we're like, you look online and you will say someone passes away, like a wife passes away, and a year later, a few months later, the person is married, and you see it as a trend with males. And I was,
Yes,
it's like, wow, we're so replaceable. But no, I mean, this is bringing it further into light. Also, what could happen after in terms of not processing the grief and then the new spouse having to deal with this unprocessed grief and both perhaps not being aware that that is the situation that they're entering into.
Right, because more often than not, men don't like to come into their emotions. So
Right.
it's more difficult for them to go and see a counselor to sit and talk through the grief process and what they're actually experiencing because they feel, and we'll get to their type of grief, that they should tough it out. So most men engage in what we call solitary mourning and they will mask their grief, right? Because
Mm.
they don't want to show that they are grieving because they have to still be the fixer, the male, the man, and
Mm.
that manliness because society also expects that a man should be a man while he's grieving. So he shouldn't be showing emotion, bawling his eyes out, expressing how he's feeling. I'm glad though to see that has changed in our culture. I'm so happy for that because on the news I've seen so many fathers weeping for their children and you can see the
Mhm.
raw emotions coming out, which is what we need. But
Yeah.
more often than that, we are not seeing the men. The men generally engage in solitary mourning. They don't want to talk about it. Some of them plunge themselves in work, especially state men. Because
Mm-hmm.
men we call statesmen, those kind of statesmen, politicians, church leaders, bishops, and those kind of persons, they generally go into solitary mourning and still carry out and execute their duties as if nothing is happening with them, as if they have no emotions and they are not
Mm-hmm.
going through. While inside they are having a roller coaster, they're having that turmoil and they are
Mm.
not talking about it. So they engage in what we call solitary mourning and mask their grief. So they hide their grief. So they are more into what we call hidden grief, which is another type of grief. So they would have hide their grief, right? We have women who hide their grief too, but the men generally engage in hidden grief, solitary mourning, and they mask their grief.
So Geraldine, I'm learning, like we don't really reach anywhere. And I've learned so much already, and a lot of insight into well the gender dynamics of grief and just also, that I didn't even recognize there were different types of grief. And
You
that
know,
the,
it's a lot
I
of
mean,
them.
pardon?
It says a lot, you
No,
know.
I did not
I may
recognize.
not cover all, but I mean, I'm just looking at some of the central ones because we
But
have
they're in
what
your
we,
book. They're in your book,
yes, they're
right?
in my book, so you have to
All
buy the book.
right. Yes.
Right. But they have what we call also cumulative grief. Cumulative grief that took place in the pandemic, where you experience more than one grief at a time. So cumulative.
Mhm.
Right. So for the pandemic, we had a lot of cumulative grief. So the COVID-19 would have taken out like 5 family members or one person. You lost your grandmother, then you lost your mother, then you lost an aunt, then you lost a cousin, then you lost an uncle. And these are occurring like 3 months apart, so you're going through a season. Like for the year, you would have probably lost like 6 persons
Yeah.
and you have not gotten the time to grieve for each person. And so the grief
Mhm.
is cumulative, and that grief can plunge persons into depression, right?
Mm.
Episodes of depression, because they would not gotten to deal with their emotion related to each grief. Because you have to
Right.
deal with the emotion relate to each person that you lost that died and not put it all together, right? So you have to look at them separately. A number of persons would not have gone through that kind of therapeutic experience. I wouldn't even have gone through that. Then during the pandemic too, we saw that even the cumulative grief impacted family systems because when you had to select the 10 for the funeral and the that number and all the family members couldn't go, that brought a lot of division among family.
Mhm.
So the grief was even more. That kind of situation lend itself to a lot of disunity in families, a lot of anger, because who should we choose? I mean, our mother have 10 of us, and here the government is saying no more than 5 for argument's sake, should be
Yeah.
present. And this 5 include the pastor and the grave digger or whoever. And so
Yeah.
now you have to sit and decide who who will go to this. I mean, and everybody wants to go because our mother. And so
Right.
that choice again brought a lot of challenges in that kind of setting and context. Then we have what we call, and I want to touch on this one if I didn't touch on any other, complicated grief.
Yeah.
Complicated grief is what we call abnormal grieving, and this is in the DSM, which is the Diagnostic Statistical Manual for Mental Disorders that we as psychologists use. Now, a person can be diagnosed with bereavement disorder, right? In the DSM,
Mhm.
they can be diagnosed with that. And that stems from complicated grief. So complicated grief is when the person begins to grieve in an abnormal manner. The grief is so compound, they have not dealt with it. So it's like they have gone into what we call a mental disorder. So they stop taking a bath, they stop living, they treat the dead as if the person is still alive. They still cook meals and set the table the same way. They still pack the bag. They still, and this a real story where a mother lost her child, and every morning she would take up the child bag and go to the gate, like she walking the child to the bus stop,
Mm.
things like that. They would still um go and meet the spouse. So if there was a person who used to walk to the bus stop and meet your wife or your husband, you still go to the bus stop awaiting that person. They will still dial the number of that person on their phone. So the grief become abnormal. Stop socializing with people. Don't take baths and not stop caring for themselves. And so the grief is so set the table same way, breakfast table, dinner table, hang up the clothes same way in that order. You can't touch the room. You can't, things like
Mhm.
that because they are now in what we call abnormal grieving. Complicated grieving is a very serious type of grief. And when we see some persons plunging into that, we have to quickly get help for that person because it can spiral into other mental challenges.
So how is this different from depression?
There's a difference between depression and complicated grieving, right? Because depression, for complicated grieving, you believe that there is still some hope. For depression, there is no hope. And
Mm.
complicated grieving can plunge persons in depression. There is a line between both, but you can still identify when the person has not crossed over depression. Because when the person reaches into depression, they are hopeless. They feel that there
Ah,
is no
okay.
hope.
Mm-hmm.
And so therefore you have to seek help for the person. So if you observe that the person is grieving in an abnormal manner, you have to start taking note. You
Mm-hmm.
know, why are you still preparing breakfast for the child? Why are you still making the child bed? Christmas, you change out the room and you paint it in pink and you set it up as it's her room, but she's not there or he's not
Mm-hmm.
there. And we have people who are doing that today, right? The pain, especially the pain of losing a type of loss, especially when a person loses a child,
Mm-hmm.
um, they can plunge into that. We have that with persons who lose a spouse too, but generally for children and
Mm-hmm.
even a parent, you have some persons who go into complicated grief.
Great. So as we start to speak a little bit about depression, could you tell us a little bit about what happens, the cycle? So, when I start to grieve, I know that there is generally a process. Could you describe what that process looks
All
like?
right. There's what we call stages in grieving.
Mm,
We generally tend to use the regular theorist Elizabeth Kubler-Ross, 1969, stages of grieving. Now, it is not a fixed thing because persons can evolve and it can fluctuate. But the first stage would be when the person get the news, they are they are angry at the news, then they go through denial. So, and after they go into denial, they can go to a stage that we call bargaining. Now, bargaining only comes when we have what we call anticipatory grief or anticipatory loss. So, anticipatory grief is when you anticipate the grief. So, this person have a diagnosis, stage 4 cancer, and when you go to the hospital, they're on the ventilators and the machine, and you're anticipating their grief. When you're anticipating, you begin to bargain with God. God, if
mm,
you make my grandmother live, if you make my child live, if you make my spouse live, I will serve you. I will do anything you ask of me. So that's when that bargaining only takes place during anticipatory grief. Because you
mm,
can't really bargain after you have lost the person, right?
mm,
Unless you're in complicated grief, then you will bargain. Because in
okay.
complicated grief, you will tell yourself that the person is not dead. So
Mm,
you're operating as if the person is still alive. So you will do bargaining there. And that is when that is abnormal. But bargaining is generally fixed to anticipatory grief. So you're
mm,
anticipating a loss. Bargaining takes place when a redundancy list is going to come out. So you're at a job and you hear that next month they're going to do some redundancy and the redundancy list is out. So you begin to anticipate if your name is on that list. And as you
Mm.
anticipate, you begin to bargain. Oh God, I have my children to go to school. Please don't let my name be on the list. And if I keep my job, I will sell out my life for you. And a lot of
Mm.
persons do that. And in the end, when if it work in their favor, they don't remember this God of theirs, but it's just a part of human nature. Some of us human nature too. But that's when the bargaining takes place. And then after the bargaining stage, persons can go into depression. That's the depression stage now. So when they are
Mm.
depressed, they stop eating, they can't sleep, they have somatic disorder, meaning that they have pains in their body that are not really real,
Mm.
things like that, and so the whole life is just the withdrawal, they engage in withdrawal and all of that. I like to use two sisters in the Bible who I believe went through grief and grief differently. That's Mary and
Water. Mary
right.
and Martha, yes. Mm.
So Mary and Martha went through the grieving process. And so Martha was rather angry. And
Mm.
so when Jesus came on the scene, and I like Martha because she was real. Martha said, where you go? You could have never be our friend. Cause you are our friend. And you are the only one who could have saved my brother. And look how long we call you. And tell you,
Yeah.
say, my brother need you. Are you coming him dead? No, we put our Jamaican context, Jesus couldn't come our yard. How we are running
Mhm.
where? And we have to be real. Some people him couldn't come on them gate. Them gonna run him. We are gonna know. But come and say, he's not a good person, right?
Yeah.
And so she was very angry, and she went to the anger stage. She was very angry with Jesus. But Mary was depressed. The Bible tells me that Mary went by herself. She took away herself. She was by herself, in a more depressed mode. And when Martha came and told her that Jesus calls you, she wanted to hear that. She quickly responded, she went. And in her depressed stage too, she exhibits some anger too, and she said, if you were here, my brother have died, But she was a little bit more calm as she came out to Jesus. So we saw that they experienced some level of grief. But
Mhm.
Jesus himself went through delayed grief because Jesus had to complete a purpose. So when he heard that his friend died, him delayed him grief process because he have a work to do. You
Mhm.
understand? So we could see that coming out in the Bible as well. So persons go through anticipatory grief when they are bargaining. And then the last stage of kubla is acceptance. So have you gone through depression? Then you get to a place of acceptance, and we call that resolved grief. So your
Mm.
grief is now resolved.
Okay.
They have unresolved grief, and there's a lot of those, right, that I won't get into, but we have resolved grief. And so the person will be at a place of resolve, where the grief is resolved, where they can move from bittersweet moments. They can remember this person, they can smile. I can remember my father, and I will smile at times. I can remember my nephew and still have the bittersweet moments. I will still have a little tear, but I have those sweet moments and I remember him. Take my deep sigh, and I can continue because I have come to that place of resolve. And
Mm.
I am continuing my life without the disease, but not forgetting his memory. So I'm taking the memory of my nephew along with me on life journey. And that's something we need to encourage persons to do when they are grieving. Take the memory of the person with you. You don't leave them. Your memory don't die and cover up at Meadow in the grave and Dovecote or Maypen or wherever we lay our the bodies to rest. So we take the memories of the deceased with us,
Yeah.
And I always say, especially the children, think about and they lose their mother or their father. And I said, you're going to, when you walk that graduation, just think about your mom smiling down and being proud of you. Take the memories. What would your mom think having, if she was here and you were graduating, how would she feel? So you take memories, with you as you go along the journey of life without the deceased person. So
Mm.
those are the stages. Now they don't happen just like while I lay them out. Some
Mm.
persons will tell you that they don't think that they have gone through some of them. They just accept it, right?
Mm.
That is not something I fully will acknowledge for persons, but if they say so, I don't fight with them. But when you have a conversation, you realize that no, you're just at that acceptance. You must have gone through when a feeling, a sense, you know,
Mm-hmm.
and whether it be denial or some aspects of feeling a little depressed at some point, you will go through that. But your acceptance come early, right?
Okay.
Because you have some persons who are like that. And then I believe also the church has schooled us wrong. I mean, in
Mm.
terms of spiritualizing grief. And so persons in the church do not grieve properly because
Mm.
what we do is we spiritualize grief. So if somebody died, they begin to tell you that God knows best and you don't grieve like someone not hope. And those words, and I spoke about that in my book, we have to be cautious. As a grief therapist over the years, I have learned that when persons are grieving, the first person they're angry at is God.
Yeah.
Most persons, most 90% of the persons, whether you're Christians or not, when you're grieving, you're angry at God, especially how the person died. Can I tell you
Mm-hmm.
how angry I was when Kelsey Ferrigan died and she wasn't a family member to me? When we
Mm-hmm.
lost young Kelsey as a nation, I
Mm-hmm.
really grieved. And as I watched her funeral, on the YouTube, I think it was yesterday was her funeral or the day before, my
Mm-hmm.
heart grieved as I listened to the different advocacy groups and the different persons talking. And then I look at this young child and then I look at her friends who sang, you know, heal the world, make it a better place. The children are crying out to us. I said to myself, God, why? Why could you allow this? Why did you allow that?
Mm-hmm.
God, this young, innocent girl. And I was angry and I was upset, you know.
Yeah.
And then you have to process as you go through it. But we at times school the church, or some persons will school the church inappropriately, and they will spiritualize grief, and they don't want to come into the emotions and deal with grief, and they will say that God knows best, and they are trying to move on. Whether it's wearing that mask now because they spiritualize grief, and spiritualizing grief is not healthy. And that is why we are having a lot of depressed and broken
Mm-hmm.
persons in the church context because they have not dealt with their emotions, right? I have had students, as I lecture the course, shared with me. I remember a particular student was sharing that she remembered when she lost, I think it was her mom, but it was her parent, and extremely close, and she was grieving. And she was a part of the praise and worship team, and she told them that she had to step away. And the ridicule and the that she got from the pastor, how can you give up God's work and all of that,
Mm-hmm.
And I said to her, let's take a break from the praise and worship, right? Because if somebody's a grief specialist, they won't understand. I mean, if it's difficult for you to give that worship because you're grieving, then step away. It's not fair to you, and it's not fair to God, and it's not fair to the congregation either. Because
Mm-hmm.
we're being false, we're not being real. But if you can
Yeah.
step away and say, I need some time to deal with my own emotions in relation to my parent that I've lost. I need some time. I need my bereavement time. It should be granted. Persons are free to step away. And it doesn't mean that they are less of a Christian, they are not serving God, and God, because God is not like that. He's not. And the scripture again is clear. It shows us that, Jesus, when he heard of the death of John, he was
Mm-hmm.
moved, and Jesus
Yeah.
just took away himself, because I think what resonated with Jesus is when John sent and asked him, are you the one?
Mm-hmm. It's
And look,
like,
are you the one? Because if you are the one, or they're going to behead me. Are you the one? They're going to behead me. Are you the one?
mm-hmm.
And Jesus had to take away himself to spend some time to grieve. Jesus grieved his own crucifixion. He went through anticipatory grief. And we saw that clear in the scripture, yes. And then he said, let this cup pass. Anticipatory grief. Anticipating his death going to the cross. This is not an easy journey for me. I'm going there. And then he came to that place of resolve because he knew he had a task to complete. And he said, in his own grief, he said, boy, not my will, but your will. be done.
Wow. I've never seen some of these scriptures this way at all. Never, never. Thank you for that insight. I have so many questions. So many questions. And wow, we're coming to the end, but I want to just ask you briefly, because you mentioned it, and I know you don't want to go too deeply in it, but what is unresolved grief?
All right, there are some types of unresolved grief. One of them is what we call absent grief, right? Absent grief is when we grieve only aspects of the person, right? And I'm going to give an example that is typical in this day and age. So if a woman is in a relationship where the man is abusive, but she used to live well, so she has money, she has the car, she has the lifestyle, and if he dies, she will only grieve that part, right? The loss of the wealth and all of that, but she don't grieve the other part. She wanted him. She's basically glad that he's out of the picture.
Okay.
You get that? But she's grieving the loss of may not being able to depends the assets, the lifestyle, those kind of things. She may grieve that aspect of it, right?
Okay.
And that's one of the unresolved grief that we talk about. Abbreviated grief is also one of the type of unresolved
Okay.
grief as
Great.
well. We have also chronic grief, right? We have unanticipatory grief. And unanticipatory grief, these are the grief that are attached to sudden loss, because we didn't anticipate these. So we don't anticipate that we're going to come home and see a child hanging from a rope, suicide. We don't anticipate that we send our children to school and we're going to get a call that a bus hit the child and the child is no more. We don't anticipate that our spouse leave out for work and we hear that there was an accident and he's no more. Unanticipatory grief, right? Those grief tend to be unresolved. It's very hard for persons to deal with those kind of grief. Come to a resolve. Sudden death, sudden loss, right? And so those are some of the unresolved grief that persons may experience.
So I'm gonna ask two questions. The first I want to ask about the church, right? But the last kind of one is we've discussed a lot of information in terms of what happens with grief, what grief's about, describing it. But I want to ask you afterwards, right? So just kind of telling you where I'm going. To kind of put on your counselor hat now. And for those, who are here. So I'm not going to ask you to answer that yet because I want to go to the church first and then I want to end kind of in that space. But for those who are here to kind of walk us through that process, But the question I have for the church is, so we spoke a little bit about what the church messaging is now. What as the church should our messaging be? There is so much loss, so much grief. We have our own and there are others, and you spoke about just the individual nature of grieving and how we all grieve differently and it looks different, but how do we, well, maybe it's two parts. So the first is, what type of messaging should the church have around grieving? And the second big question is, what do we say? How do we support someone who is walking through, grief, particularly like an unanticipatory grief?
All right, first for the church. So the church message should really be one that encourages persons to go through the grieving process. It is biblical. We saw that Jesus himself grieved, and the church should encourage that, right? So the person should go through the grieving process. The church should not necessarily be ready and quick to just throw out a scripture and give persons. But I think that's the only thing that we know, which is fair to the church. And nothing is wrong with scripture. And I'm not saying that because I'm a preacher of the gospel and I love the word and all of that. But there's a time and a place for everything. And I always use this context. When a mother loses a child in a tragic way, and the first thing somebody said to her is, God knows best. That the mother doesn't want to hear that at that time. That can come after Those things come later down as persons go through the grief journey for them to understand. And they need to understand the role of God in all of this. What can He be saying in all of this? Is there a message? Is there a word for you in your time of grief? Because in everything that we go through, glory should come to God. What glory will He get out of me losing my spouse, my child? But the glory, you're not seeing it now in the immediate, but the glory may come later down. We can understand that. So the church should be practical in its message to encourage persons to go through the grieving process and to know that through that process, Jesus is with you. Because He is a man of sorrow and He's acquainted with our grief. So He's journeying with us through the grief. So if we're angry, He understands our anger. If we don't want to talk with Him right now, He understands that we don't want to talk with Him. We're not in a place to talk with Him. If we decide, well, I'm not going to be talking, I'm not going to be praying, I just want to, He understands that. Don't play the role of God and become judgmental on people's grieving style and let them feel like they are going to hell and they are condemned because they are grieving a particular way. No, just encourage persons to go through their grieving process and understand that on this journey of grief, Jesus is with you. Because He will never leave you nor forsake you. And you may not feel Him now, and that is okay. You may not sense Him now, and that is okay. But He's on the journey with you eventually, at some point. And then the church should also encourage the persons who are grieving to go through therapy. And oftentimes church don't do that. They tend to spiritualize and tell you to pray and fast and whatever. And there are thousands of persons who have prayed and fast 21 days, 40 days, and still have that void within, and is still disturbed, still distressed, because they have not come to that place. Because they need to come to that place of resolve. So the therapy must be holistic. It's a holistic thing with integrating prayer, the word, and their counseling, of course, their therapy sessions. So go through that. How do we lend support? Again, I am big on lending support. Sometimes if you have nothing to say nothing. Say nothing at all. Because we can say the wrong thing and cause more pain, and the persons can resent you in their time and say, they don't want you come back after them blood, come to them space because you have said this. You know, we can say the wrong thing. And if we don't have anything to say, let's sit. Sometimes the persons wanted to sit and just be quiet. And know that we tend to be talkers as nature, but you have to learn. Grief work is something that people have to be trained in doing. Sometimes some persons don't really want to talk. If they talk, you talk. If they don't want to talk, you can sit there, right? Be there for them if they have children. Help to drop off the child at school, no? Practical things. How can we help? Do you want me to drop off the children at school? Well, if it's a mother that lost a spouse, lose your husband, they have children, and you still have to continue on with life, how can we help? Take some turns, take the children to school, pick them up back, give that mother a break. Sometime we can help with that. Whatever things you need to get done, we can find out. How are you with supermarket goods? What do you need? What can we get? And you lend support like that also. You lend support by going if the person wants, because some persons want to remain by themselves. And still, I won't encourage you to just leave them all by themselves because we don't want them. But you can find a way to get them to check in with them at different points and to see how they are doing. So you do that. You don't bombard them, but you check in with them because you have to respect also person's grieving space. And if they do not want anybody in their space immediately, that is fine. And don't begin to comment and say, so the whole of you got the same church and she have dead and she don't want nobody here. She don't want you there. And that is fine. Because sometimes we feel like if we are not there, and the person don't allow us to be there, something is wrong. No, nothing is not wrong. People grieve differently. There are some persons that want somebody them yard every night. Every night they want somebody there with them. Play games. They just want the company and they want to see people. If that is so, as many as persons at the church, break up yourself in groups. These three go tonight, next three tomorrow night, another three another night, and you're there with them and help them through whatever they're planning. You have a prayer meeting if they are open to that. You have a time of prayer with the family if they're open to that, and you continue on, right? Didn't touch on a critical part of the rituals and grief and the role of the church there, because there are some things the church don't practice. And if the church don't believe in nine night, well, they didn't know that, but you still have some people in the church who will still do that. Because when you have a loss, it's not you alone. So you may have
Right.
siblings who are not same and them who have a nine night. And you can't really fight them. You just say, all right, me, I'm take for myself. I not want to be there and all of that. But there may be people who of the church who still would want to go and things like that and lend support. So those are things you have to look at. What is the role in the ritualistic part, ritual and the grieving part, right? Because of course the funeral service is a ritual. Many people don't know that, but it is. So having the ceremony and laying the dead to rest, that is also a part of the rituals. But there are other practices that may be done that the church don't endorse. And we also have to make sure that we know where we stand as a church and we take our stand as a church as it relates to certain rituals and practices with grief and loss.
So, so when we are seeking to support someone, is it that we are following their lead? And if so, how do we do that in a way that demonstrates empathy and sensitivity to what they're going through? Because as you said, persons grieve differently. So you have one who may want to be alone, one who may want persons. Do we expect them to ask? Do we ask? What would you suggest?
We can ask. I normally recommend how can we help?
Okay.
First, you will say to your church brethren and anybody that is grieving, how can I lend any assistance? How can I want to be here for you. I am here to talk. But that is always I am here to listen. I always say that to persons who grieve. I am here to listen. You can call me anytime. I am here to listen. Right? And at points, I will check in. More often than not, the persons will call and say, I am feeling this way, and I will give some guidance to that. Right? But I am always here to listen. And how can I help? Right? Do you need any assistance with the children to pick up from school, to go to school? What can the church do? Do you want us to assist in offering any lunch money? Because maybe it is a father, so we don't know. So finances, how are you financially? You ask some question like that, because we have to find out from the persons. But then, how are you financially? In relation to, all your preparation, all of those things. You find out questions like that. I mean, some persons may not be open to sharing with everybody. And so the leadership of the church, I would always recommend to ask the questions in terms of finances. You can ask, but a random person can ask, who is willing to help and have a good heart, not to go back and talk, because we have to be confidential. But someone will say, how are you with lunch money? Can I help? And if the person said yes, then you can give whatever you feel led to give towards the children's lunch money. Or are you with food? You want me to drop off some groceries, and you may buy some, in a case of water, some juice, because maybe they may have visitors and they want to hand out juice or water. You drop off a case of water, some juice. So practical ways to help them as they go through the process. Not only pray, and of course we're going to pray and give the words of encouragement, but we must always have practical ways to help the persons as they navigate through the grief.
Okay. So, the last question from me just before I, see if there are any questions in the chat. Putting on your counselor hat, knowing that there may be persons here, for example, for me, I had a friend who passed away tragically last year, and the year before that, I had a cousin, so for persons like us here, could you walk us through, how to move to that place of acceptance, a resolve?
All right. The first thing I would want to know is, where are you now in the grief process? Where exactly are you? That must be identified. Did you deal with your emotions in relation to the loss, or did you suppress them? Right? How did you actually feel about the loss? What type of loss it was, and how did you feel? How attached were you to this individual that you lost, or this thing that you lost? Because even though I am emphasizing that, I want to say that people lose them cell phone and grieve bad.
Mm.
People lose a cherished dream,
Yeah.
wanted to become a doctor, and the
Yeah.
parents never have it. And they end up in another profession and they are grieving to this day, and badly too, because that was their dream. They lost of a cherished dream, and we're seeing them daily going to
Mm.
work as a receptionist, or as an accountant clerk or something, and they may look a particular way. Maybe one like, why are you always sad? Or they have that sad look. And we don't know that this wasn't my dream. This is what I had to settle for, because there
Mm.
was no help for me to get to that cherished dream. So the question would be, say a question, where are you at now in the grieving process? How attached were you to the thing or the person that you have lost?
Mm.
What emotions did you experience? Right, and
Mm.
look at the emotions that the person would have gone through in relation to the loss. Um, where are you at now without the person? If the person was here, some of them have to take them through that process. If the person was here, what would you say? What would have been your last words with that person? Um,
Mm.
what if the person had died and you had unresolved conflicts, issues that you had with the person, right? I always share with my students, they laugh. I said, you have persons who are angry at the dead, especially if you know one partner, the person dead, get your partner dry, and all
Mm.
of your money gone on the drain, My word, oh,
Yeah.
you're angry that they dead, you want, and nobody to give back your money. You
Yeah.
stand guarantor for loan with the person, this loan are you, and if it's not an insured loan, if the person die, you them a come for feet. I mean, and the person die, you're so angry, at the
Mm.
deceased. So those unresolved things, where are you, right? Are you struggling because you're not at peace with the deceased? And so we have to find a way to get you to make peace, because you have to go through all of that so you can get to that place of resolve. So coming to a place of resolve, not just a walk through and acceptance, not just a walk through, you have to go through different processes. You have to look at emotions, you have to look at last words, last encounters, um, how you felt about the type of loss, if it's a sudden loss, if it was natural causes, I mean, if it was suicidal loss, how do you feel? If it's act of domestic violence and you're so bitter and angry at the other person, or the person themselves who remain in that relationship when you were advising them to leave, and this is not good for them. So there are a myriad of things that you have to look at as you deal with each loss. So you have to take each person differently based on the loss, based on their
Mm.
attachment to the loss, based on the emotions that they would have experienced in relation to the loss, right? So those are things that you have to take them through. Having taken through them, and you give them like coping strategies. You can allow them to journal. Do a journal. You can allow them to create things in memory of the person, plant a tree. You can allow them to do memoirs, poetry, different things, so that they can keep the person alive, and they're not going to just cast them off. You're taking the memories of the persons with you. I mean, these are coping strategies that we would have to give to the persons as they go on a daily basis. Get involved in groups, get involved in
Mm.
support groups, get involved in activities, get yourself back into the groove of things again, start socializing, join this kind of a club, different thing, different movements, and get yourself involved as you continue to process the grief to get to that place of acceptance.
Mm. Okay, so I'm gonna just open for a few minutes to see if there are any questions in the chat. Encouraging persons to ask any questions if they have. If they can ask it now. But very, 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 very insightful. So like I need to come do your course. um, but also as we wait, one of the things that I'm really thinking is how important that there's, that churches have a grief counselor, a trained grief
Grief counselor, yes.
counselor, lay counselor, or trained professional at church, so that when
And you need
someone
a
is
trained grief counselor. You know why I say that? And no disrespect, but not
just
all pastors are counselors. And we
I
need to be,
mm,
and I say that without no apology.
mhm,
Not all pastors are counselors. And you will go to your pastor, the person tell you them giving you scriptures to read. right?
Right.
Not all pastors are trained counselors. You need to go to a trained counselor
Mhm.
that can take you through the process, right? And help you to get back on track with your life. So you
Yeah.
need that. You need that trained person in the area that specialize in the area. Because grief work is not a simple work. Grief
Yeah.
work is a lot of work,
Mm-hmm.
right? And you need persons who also have the passion to help persons who are grieving,
Yeah.
right?
Yeah.
You have to know it. You have to sometimes live it. And not everybody who live it can help, but you have to be able to walk persons through the different stages and all the different symptoms that they may experience as they go
Okay.
through the grieving process.
Yeah. Okay, so I'm not seeing any questions in the chat, but I think what I would ask, because I didn't ask this, and I think it's just very important. How do children, so children and teenagers grieve differently? Yeah, as parents, if our sibling passed away, if a friend passed away, as children or teenagers, and how do parents support them in that?
Our children, when children are grieving, first and foremost, too, when there's a death, I believe it is important that it is shared in the language to the child based on their developmental level. Critical, right? So children as early as 4 years can begin to understand that somebody has died
Hmm.
and will not be coming back. Now we must not use certain language because you can tell a child the person is sleeping and they will ask you every day when the person is going to wake
Mm.
because they associate it when you're sleeping, they're going to wake up.
Right.
Right? So you have to be very factual with the child, but utilize the languages that the child can understand based on their developmental level. So you will not see mommy again.
Mm.
She will not come back. She is
Wow.
gone. Right? And you have to
Mm.
tell them that. So you tell them that they will not see the person again. Or don't tell them that the person is sleeping, children. Also, you must tell the child using a comfortable tone and in a comfortable setting. Why we have so many children going through shocking grief and not able to process grief, it's how they are told too.
Mm.
Sometimes you just go to say, come, your mother dead.
Yeah.
Come, it's just not, it's just told in such a callous manner.
Yeah.
And I don't think the person carrying the news is intention is to do that. But it's just that they probably don't know the right way. So you
Mm.
should really sit the child down and you should um, tell the child. I
Yeah.
use this scenario because I remembered there were some young men in a particular community who all lost their fathers and they
Mm.
developed a resentment towards the police because all of them fathers were killed by the police.
Mm-hmm.
And um, police kill your father. And so you just tell the child that.
Mm-hmm.
It presented the child's father as one who was innocent, if you get what I'm saying,
Mm-hmm.
and didn't have a role to play, particularly in their own death. So you
Mm-hmm.
presented that um, kind of put something in the child, and the child was become resentful and detached. And
Mm-hmm.
so, based on that, a particular gang was formed in this nation, and they call
Mm-hmm.
themselves a particular name. And they, yes, yes, and they were very brutal
Yeah.
towards killing men and the police and all of that, you know. And so we have to know how we break news to children. Children, however, tend to blame themselves also for the death of their parents, but we don't know that. They wonder what role did I give them too much trouble? I wasn't hearing.
Mm-hmm.
And they tend to blame themselves as they process the death. They will have nightmares, things like that, right? They can regress. Adolescents will regress. Adolescents will become also aggressive when they
Mm-hmm.
lose their peers. Um, Adolescents, you have to take time to get them to process the loss. they try to find out now their identity in relation to the loss, especially when they begin to lose their own peers. They kind of wonder, no, who am I now again? Because they're still finding themselves in relation to this loss. And so they are the other ones too. They may not want to have discussions about the loss, right? As they struggle to, to come to an acceptance with this type of loss. And so their grief can be different. Some of them, especially for the boys, then go out, them kick ball and play ball and try to tough it out. Try to tough it out. And parents tend to feed that. Because if you see a boy crying, we are crying for you, a girl. We still a ball for your father done then already, your mother done then already, your sister done then already. We a ball for you can't your boy picking you sit on a ball. So you don't allow them to come into their emotions to understand what is going on. And that's why we have so many cruelty coming from them too, because they are not able to release their emotions, release themselves. And so we find that with our boys, right? It is always easier now. Females tend to have the outlet, the males don't really have the outlet. So it's easier for a female to release their grief, to talk about it, than a male, right?
Yeah.
And so we have some of those boys regressing as well, teen boys, girls too at times. We have rebellion may come from them even as they go through the grieving process. So it is important that they go through their own therapy as well. And we have to really take the time also to go through therapy with them. They must be integral, both children and adolescents must be integral in all the preparation process, especially if it's their parent of the funeral. You must talk with them, they must give their input, all of that should take place, right?
Okay.
So don't think that because they're a child, they don't have anything to say, right? What would you like to say? A poem? What would you want to do? Do you want to say anything? Do you want to do anything, right? For the children, especially the younger children, they may have to do some what we call art therapy, drawing, play therapy. So I remember
Okay, there.
years ago, a little girl lost her mother, and so they brought her to me because she wasn't coping. At the time, she was about 5, 6. So I had to let her do a lot of drawing. So, can you draw mommy when she was in the hospital? She drew her. Where is this? The hospital bed. Then I had to let her draw. I had to get pictures of the different things, the ventilators. Her mother was on that, and to show her what she was on, what was happening, and point it out to her. So you took her through the different stages. I ended up had to go to that funeral service just to walk the child through, take her to the casket, let her look at mommy, and tell her that she can say her last word to mommy at this time. She will never see her again, and talk her through that process. So I went to the funeral, and then I guided them at the what to do at the graveside. I didn't go to the graveside, but I went to the service because her father asked me to come to help that process too. So I took the journey with the child straight through until the funeral to get her to come into her own to understand. And she is now at a healthy place as an
Okay.
adolescent because
My
she
God.
remembered the journey. So, but because we don't take the time to do these things with children, we just expect that they experience a death and loss, even their friends. Casey Farragon's friends, they are fearful, they are scared. They are very scared. And that incident has caused a lot of other children who don't even know about from the hear the news. They are now afraid. They are scared. We have to help them. We have to guide them through because in their own way, now they are grieving and they're grieving their safety. So that's how the grief unspoken, grieving your own safety. So the children are grieving their lack of safety. And how do we get them to deal with that? Or we get them to be proactive so that they can know the safe space and to understand what is happening around us. So our own approach to helping children and adolescents grieve evolves as time goes by based on the type and acts of deaths towards children. And we're seeing that the deaths towards children are more vicious.
Yeah.
And because of that, it has driven a lot of fear in our children. So children are actually grieving already just by watching the news, just by hearing things, and it's not being dealt with. So sometimes we see them act up, we need to get in their headspace. What is going on? And even as they may hear some of the news, you ask them, how do you feel about this?
Mm.
So we have to really talk with them, talk with our
Yeah.
adolescents at this stage so that we can help them to navigate the grieving process.
Thank you so much, Geraldine, for this conversation. I mean, I recognize I could ask so many questions, so I just need to be reminded. And for you to remind those who are here, how can they get the book? Where can they find it?
Oh, and a favorite grief, it is on Amazon. You can get it on Amazon. Once you go on Amazon, you
And what?
can get it.
Mm,
You
mm,
can also make contact with the author because I have some copies too.
mm.
To get that, but you can purchase on Amazon.
Okay, okay. And the process for reaching out to you as a grief therapist.
As a grief therapist, you can get my number. It's 876-376-3765. That's the number, or you can email behaviorchange2012@yahoo.com. So you can access my services to deal with
Oh,
any form of grief therapy, workshops on grief, training on grief, and any other type of training that you would need. Children with autism, special needs children, assessments, whatever your needs are in relation to developmental milestones for children, you can always reach out.
okay. Thank you so, so much.
Thank
And
you
I
very
pray
much.
God multiplies you.
Thank you.
Because what you provide is so needed to, just the well-being for us to heal. So just want to thank you again for coming on, sharing
My
your knowledge,
pleasure.
sharing your heart. And I think this conversation is so important for us as individuals, for us as a church, for us to be able to, engage with God, be intimate with God, and also do what He has called us to do and live, find some way to still live with joy in this really challenging world.
Yeah,
You
yeah,
know,
yeah.
so I just also want to thank those persons who joined us today for this conversation. I really hope it really contributed to your own healing process. And as you continue, feel free to, follow me on Dr. Joe Talks on Instagram, and this will be uploaded to the Life and Godliness series YouTube channel in the week to come. Thank you so, so much, and have a good evening. Bye.
Thank you very much. Bye, bye, bye.
Okay, so just seeing some comments here. Very thorough presentation, very practical, very insightful, excellent work. All
Thank
right.
you.
So thank you so much. Have an awesome night, and thank you for going over a bit here too.
All right. Thank you. You're welcome.
All right, bye.